Prescription drug overdose deaths are skyrocketing among women. The Centers for Disease Control and Prevention says men are still more likely to die from those kind of overdoses, but women are certainly closing the gaps. The CDC said last week the number of women dying from prescription painkiller overdoses has increased more than 400% between 1999 and 2010. The Federal Health Agency reported 10,000 men died in these kind of overdoses in 2010. This is compared to 6,600 women. The psychologist and manager of recovery services at Peninsula Outpatient, Dr. Nell Osborne, joins us now with more information to pass along. Thanks for being with us.
Thank you.
These are alarming numbers. What's your initial reaction when you hear this?
I think that the numbers are just confirming what we've already known in the field of mental health. For several years, we've been seeing a rise in women who are in treatment. We've been hearing from the ERs about the number of women who have gone there for treatment of overdoses, some who've died. So it's really confirming what we've known, what we've suspected.
So the big picture, yes, these are the numbers. Does East Tennessee mirror these numbers?
Yeah, I think that we have, we reflect very realistically the national numbers. I don't think we're more or less. We certainly know that we are facing a local pain pill issue, and the government, the federal government, the state government, the Commission of Mental Health have all taken some steps to stop that trend, to make it harder to get pills, but we're still seeing a huge number of women in treatment.
Let's talk about the root of the problem, and I know we could talk about that all day long, but based on what you see, what is leading so many women down this path?
Yeah, I think there's several things that I hear about women who come to treatment. A lot of them were prescribed medication for pain when they went in for surgery, and they're not told in the beginning that it might be an addictive substance. They're not told that if they feel like they don't need it, that they should dispose of the medication and take it back to their pharmacy for safe disposal. They're not asked perhaps if they have addiction in their family history. And I know that a lot of women who come to treatment have co-occurring disorders, what we call co-occurring. They may have a mental health diagnosis and then develop an addiction. It may trigger their mental illness. It may exacerbate the symptoms of that, make those symptoms worse, stronger, and certainly getting off of an addictive substance like an opioid is very challenging, especially with somebody with another diagnosis.
Where can they turn? What can they do if they really want that step in the right direction?
Right. Opiates do not require inpatient treatment to come off of, but it does take support. It does take medical oversight to help people through that. So I would suggest that they call a community mental health clinic, that they talk to their primary care physician, that they be honest, that they talk to their family members. Of course, I work with Peninsula, so I would suggest that you call us or Helen Ross, but the first step is to admit it and to seek support and to seek help.
And we certainly have folks who will do just that. Dr. Nell Osborne, thanks so much for being with us. We appreciate your time and your insight.
Thank you.